My name is Sue Maillard. I'm a specialist physiotherapist at Great Ormond Street Hospital in London, and actually I specialise in treating young people and children with myositis. And so, though I know you're all a little bit older than my age group, hopefully some of the work that we do with the children and my talk here will also be relevant for you and maybe give you some ideas as well to help you with your myositis. And my colleague is also going to introduce herself.
Good afternoon, everybody. My name is Helene Alexanderson, and I'm a physical therapist and a PhD working at the Karolinska University Hospital in Stockholm, Sweden. I see only adults with polydermatomyositis as well as inclusion biomyositis. After Sue has, after her talk, I will speak to you a little bit about how we have changed the view of exercise over the years. Welcome.
And I wrote that talk. And so you'll also have to bear with us because I cannot control my slides from here, and so I will be nodding and hopefully moving through the talk that way. What we had planned is that I will do about a 25-30 minute presentation, and then Helene will do the same thing, and then hopefully we'll have time for questions as well. But I think you'll also see on the programme that there are other times where you can come and ask specific questions about exercise from either one of us at different times in the early bird and late evening sessions as well. So please feel free to, ask your questions. Okay, thank you. Next slide. I just really wanted to say, children don't get inclusion body myositis. It's not something that that we see in that population. But what we do see is, we call it juvenile dermatomyositis because they're under the age of 16. But actually what we have started to recognise is that there's a very rare form of myositis called SRP, which I'm sure you'll be hearing about throughout the conference. It's a particular antibody. And we have actually now recognised 3 young people, they were 15, so the older age group for us, who have this very rare form of myositis, but it's very difficult to treat medically and with physiotherapy, and they get very weak very quickly. So I think it's actually quite in alignment to some of the more adult presentations. So if you have a look at the taller Afro-Caribbean girl in the yellow t-shirt, she actually, as it turns out to be the first young person we met with this condition. And we have 2 others as well, both of whom also happen to be Afro-Caribbean. But this is very new research and new understanding of the disease. But I will draw on that because I think it's much more similar to adult type of disease as well. It's also very rare for young people to get polymyositis without skin involvement as well. So really what I wanted to think about is 2 components of myositis. One of them is obviously the inflammatory component, and you're going to hear lots of different aspects of that throughout your time during this conference. Lots of medical and scientific points of view. And I really want to talk about the acute onset because I think there's lots of misunderstandings about where exercise can play a role in acute aspects of myositis. But I also want to mention about deconditioning because I think this is really forgotten when we think about these complicated conditions that have a very profound inflammatory component. But muscles particularly absolutely need to be moved and used. And so if you've got a disease that's causing some weakness and tiredness and you're not feeling well, then you also have the added complication that you become very deconditioned generally. And so other muscles that may not be affected by your disease will also lose their strength. And that's where I think the role of physiotherapy and exercise is so invaluable for you. In fact, it will be able to make a difference to well parts of the muscle as well as not so well parts of the muscle. And I just put some statistics down there, and about normal muscle, if you don't use it, you lose it very quickly. Within 24, 48 hours, you can start to see a loss of muscle strength. And the maximum muscle strength is lost within the first 6 weeks. So there's a steep decline in muscle strength if you're not using it, and then it settles down a bit, but we'll carry on losing it. That's normal muscle, that's without a disease inflammation going on as well. And the other really important aspect is muscles only recover if you use them. Now, obviously, when I'm talking to the kids about this type of thing, you know, I'm telling them if they're sitting in front of their PlayStation, they might get really strong thumbs, but not much else will be exercised. So they can't use that as a way of exercising. So, but it's the same principle. If you don't use your muscles, they can't improve and regain their strength and function. I was going to talk just a little bit about, just slightly about the science of muscles and inflammation. Because there are lots and lots of reasons why muscles get weaker with myositis. Some of them are inflammatory, so the actual disease process itself. Some of them are biomechanical. And what I mean by biomechanical is that once you start getting one muscle that's inflamed, not working well, your body tries very hard to compensate, and so it will fire up other muscles to take over. So what you end up with is other muscles taking over that function, that action, that movement. And so therefore those muscles get stronger, and the muscle that was originally affected by the disease, for example, carries on getting weaker because it's now not even being used either, because there's another muscle compensating. Does that make sense? So you end up with this big muscle imbalance through no fault of your own, no planning, but because the body was trying to be helpful and trying to keep going and keep you moving. And so therefore, loss of movement, loss of activity, as well as the fact that, you know, the general unwellness that goes with getting these types of illnesses and the muscle imbalance that you develop, all contribute to the amount of disease that amount of muscle weakness that you experience. And so from my perspective, if waiting for a medicine to fix it is the only thing that's being done, then you're actually missing out on a lot of treatment that you could do for yourselves in order to help redevelop some of those muscles that are possible to redevelop. And I was going to talk a little bit about cytokines. I don't know how many of you know about cytokines. I don't know. Is this your first introduction? Hands up if you know what a cytokine is. Oh, okay, one person, not two people, okay. So, well, I'm sure you'll learn lots about cytokines, but cytokines are little molecules in your body that take messages from one cell to another. And there are millions of different cytokines, and most of them I'm sure we don't even know anything about. But there are certain cytokines that we do know about. There's a cytokine called TNF-alpha. Has anyone heard about that? And oh, okay. so there's a really important cytokine called TNF-alpha that's really important in muscle control and function. And there's another cytokine called IL-6. And I'll talk about these because they are important in certain types of myositis, and they are also really important in normal muscle function. And I'm really sorry, I know I sound a bit hoarse, and I'd almost lost my voice this morning, so I do apologise. I had a 17-year-old son go to some music festival and bring back a delightful cold, so that was joyful. Okay, next slide. So the biomechanical changes are the things that I really want to sort of think about and focus on particularly, because many of you will experience lots of secondary changes due to these biomechanical changes. And so, as I mentioned before, this muscle imbalance, once it starts, because the idea is that all muscles are roughly around the same strength, so that when you need to use them, they all are used effectively. What happens is if you get a myositis and some muscles get weaker, other muscles take over, you now have some strong muscles and some weak muscles. That's an imbalance. And that automatically changes the way your muscles pattern, so the way they're moving your body, and particularly moving your joints. And that then puts abnormal forces through your joints as well, which would obviously result in pain and tiredness and feelings of discomfort and instability around your joints as well. And that whole combination is not only due to the inflammatory process of your disease, but it's also due to the biomechanical changes secondary to the disease. Does that make sense? Yes, good. Okay. Next. So what also makes the muscles weaker is that actually, I think we've already done that one. Next one, sorry. So I'm just going to talk a little bit about TNF-alpha. So that's this cytokine that I mentioned that actually is important in a variety of different myositises, particularly in juvenile dermatomyositis, but also in adult myositis as well. But TNF-alpha is absolutely vital in normal muscle function. So its functions are basically to control the way that muscles are developed and grown. And if you have a change in your TNF-alpha, what happens is that it absolutely inhibits the contractile function. So what it reduces is the amount of force that the muscle has. So if you don't have enough or you have too much TNF, you reduce the contraction force of the muscles. It also causes muscle wasting if you have an abnormal balance of it. And long-term increase causes abnormal growth of muscles and severe myopathy as well. Next slide. And so what you actually need from TNF-alpha is this normal biphasic approach, because you need the right level of TNF-alpha, which actually causes new baby muscles to grow. So you need a certain amount. If you have too much, then actually what happens is you get more apoptosis, which is programmed cell death. So you need TNF-alpha to grow baby muscle cells. You need TNF-alpha to get rid of the old muscle cells, so you keep regenerating new muscle cells so they're fit and well and healthy. If you have the incorrect amount of TNF-alpha, you end up not being able to make enough muscle cells, and you have more muscle cells killed off, which is why you end up with weakness, lack of function, stamina, and smaller muscles. Next slide. IL-6 is also a really, really important cytokine. It's felt to be a pro-inflammatory cytokine, so it's very commonly, you will have changes in your IL-6 really frequently throughout your lives. So anyone who's had the flu and ended up with muscle pain and joint pains, that's because your IL-6 went up to a really high level because of the infection that you had. But also if you exercise a lot, more than you are used to, anyone who gets delayed onset muscle pain, has anyone ever experienced that? Yes? So delayed onset muscle pain is because of an increase in IL-6. It's actually entirely normal. Your muscles need IL-6 to be able to regulate how much energy you need, and also then how much repair and rebuilding of muscles that you need to do as well. So basically, how much IL-6 is produced is dependent on the type of muscle work you do. So does anyone know the difference between eccentric and concentric muscles? So, I mean, if you're a physio, they're really important differences, but eccentric and concentric are the opposite to each other. So concentric would be me lifting up this microphone to my mouth so that I'm lifting it against gravity and controlling it with my biceps muscle. Now, eccentric is actually putting it back down again, and I don't want to drop it, I don't want to smash it back on the table, but I need to control it, but it needs to be controlled against gravity. But that means this muscle still has to work, but in a controlled, gradual way to put it back down again. That's really important, obviously, if you've got a cup of tea or a cup of coffee or a beer or whatever it is you're drinking. You don't want to be chucking it back down on the table again and spilling it. But eccentric muscle work is much harder than concentric muscle work. So the more you do eccentrically, the more IL-6 you'll produce, the more delayed onset muscle pain you'll experience. Endurance, so the longer you exercise for, produces more IL-6 versus resistance exercise. And it's also very dependent on the amount of time and effort that you put into the exercise. It's also very dependent on what you've had food-wise before you exercise as well. So there's a lot of work, particularly related to bodybuilders and athletes and sports people in general, about what they take as a supplement before they exercise. and that actually there are lots of products out there that are designed specifically to make glycogen very available for the muscles, so that you end up producing less IL-6 because it's easier for the muscles to get this energy. Now, there is in children some work being done to see whether giving these types of supplements help us improve gaining muscle strength of children once they've developed myositis. But that's only just started and there's no results from that. But as a working in an acute setting, it is something that I constantly talk about with the families and the children, making sure that they've had adequate food intake throughout the day in order to make their exercise as effective as possible. And we've been working on doing, particularly with these younger people with the SRP positive myositis, giving them a slightly higher protein diet so that they actually have more protein available to regrow and redevelop their muscles. But this IL-6 change is completely normal, and you actually need it in order to be able to regrow and re-strengthen your muscles. So it's sort of a good pain that you get after exercise, but of course it's in moderation. It's not the same as marathon running, where that's extreme exercise and your pain would be massive afterwards. What you're looking for is doing a bit more exercise than you were capable of, but not much more. So that it's a good response, it's not a bad response. Does that make sense? Okay, but the point of IL-6 is basically to enable a balance and a homeostasis of providing the right amount of energy to muscles. So the fitter the muscle is, the less energy it needs to do that job. So fitter, stronger muscles produce less IL-6 than weak, deconditioned muscles. Is that clear? Next. But also what we've found through a variety of different amounts of research is that you also need to do a degree of exercise in order to cause muscle repair, because without exercise and movement and activity, there's no stimulus for those muscles to regrow and regenerate. And so the IL-6 is also, and the TNF-alpha, both of them are very importantly triggered by the amount of exercise that you do. So no exercise produces no triggering, and is then very difficult for you to repair your muscles again. Next one. There's also a lot of evidence around different types of exercise, and basically the moderate progressive resisted exercise program, I'll talk about it a little bit more, has also been shown to be anti-inflammatory. So it actually reduces inflammatory responses in joints, in muscles, and generally throughout the body. And actually it is good at improving your immune system. Excessive exercise reduces your immune system, and actually that's not what we're talking about. We're not talking about making you all go marathon running. We're talking about starting at a base level and gradually building on that level in order to facilitate improvement and regrowth and an anti-inflammatory response. The other thing I was just going to talk about is about muscle repair. Now, in young people, well, basically we're all born with these particular cells called satellite cells. Now, I don't know if anyone's heard of satellite cells. So satellite cells are basically the body's way of repairing the muscle fibers. So they're like baby muscle cells, and they sit there not being differentiated. They're not really doing anything at all. They're just these tiny cells waiting. And you're born with a finite number, but actually it's a massive number. But you start to lose those numbers from about the age of 9. But you do have them all the way throughout your life generally. And those cells are the ones that you can facilitate to come back and repair your damaged muscles to a degree, okay? But obviously there's a way of stimulating those cells, and the only ways that you can stimulate those muscle cells to come back and repair and regenerate is by exercise. Next slide. And the basic, oh sorry, go back again, sorry, I took it out. And basically, the way that you do the exercise will determine what type of muscle fibre that you rebuild. so the more eccentric work or versus concentric. So your exercise program basically needs to have a combination of different types of muscle work in order to stimulate these satellite cells to come back and replace your muscle fibers in order to make them effective again. Okay, next one. Now, in young people, we see a very common patterning of muscle weakness. Now, I know in inclusion body myositis it is more different, but generally in the human body, if you become deconditioned, so if you get the flu or you stop exercising or you break your leg, there is actually a very common pattern of muscle weakness that you develop straight away from that. And that would be a weakness of muscles around your hips, so hip abductors, I'll talk about these particular muscles a bit later, but hip abductors, hip extensors, inner range quads and plantar flexors around your ankles. And those muscles are absolutely vital for keeping you in an upright position. And they're the muscles that in all humans get weak the quickest, and in myositis they also get weak the quickest as well, so you have a double whammy. And that actually then causes this muscle imbalance. But then also you get abnormal muscle patterning. Do you know what I mean by patterning of muscles? So there's does anyone not? Some people don't. So basically the way the human body is programmed for every movement is that there's a certain way each muscle would switch on and move. So for me to be able to lift up my microphone so that it's not like this, in a weird way, there's a particular way that the muscles would pattern their movement to be able to control it smoothly and carefully. Because I don't want all the muscles firing at the same time, they need to work in sequence, and that's what muscle patterning is about. And from the conference from last year, I realised that that was something that I needed to think more about, is how muscles pattern themselves. Because you can get this imbalance very quickly, that automatically changes the way your muscles move and the pattern of that. Because if one muscle's weaker, another one's taking over, you end up with the wrong muscles achieving the action, but maybe not as smoothly and efficiently as it should be. So again, the role of a therapist would be to help think about how to change that movement to regain normal patterning and control. Next slide. We did some work in the children looking at fatigue as well, because fatigue is obviously one of the biggest symptoms that young people talk about, and I'm sure you experience as well. And there are many physical reasons for fatigue with your myositis, without a doubt. But what came out as really interesting from us as well is that not only were there very many physical reasons affecting your levels of fatigue. Excuse me for 1 second. The air conditioning does not suit me at all. We don't have it in the UK. It's always too cold. We always have central heating, so it's completely different for me, sorry. But one factor, particularly for the young people, and I don't know, I can't speak for adults per se, but actually two factors that also really affected their perception of their fatigue were emotional factors. So depending on how confident they were within themselves, within their family, within their school setting, their friendships, also determined the level of fatigue they reported, but also psychological factors. So their perception of illness and their perception of normal fatigue levels were also really, really important outcome measures. And basically, so what I'm trying to say is that some children and their families, because they've got a diagnosis of dermatomyositis, perceived that they were ill, even though we put the children into full medical remission, so there was no sign of active disease. When you talk to them about their tiredness, they'll say that they're still more tired than their friends because they have dermatomyositis, though there was no clinical link. So it was their perception of illness. I'm not saying it's right or wrong, I'm just stating a fact. And the other one, particularly relevant for young people, because sleep and fatigue levels change throughout your lifetime. So, young children, babies sleep a lot, that's what they do. They wake up and they feed and they sleep, and you expect that. Toddlers, you expect to have a lot of energy in the day and to be busy and then to go to bed and zonk out and sleep to the next day. But teenagers change completely. So whereas before, you might have had a young person, 10, 11, 12, sleeping a good 10 hours of sleep at night time, easily going to bed, you suddenly get this young person who can't sleep before midnight or 1 in the morning, and then can't wake up again until, 11 or 12 in the morning. And if you've got an illness like myositis, it's very easy to perceive that the illness has caused that change, when in fact that change is normal for development. So in adults, it's obviously you've developed, you've grown, and you are as you are. But I think I just really wanted to put out there that fatigue has many causes as well, and it's not just necessarily disease activity, and it's just giving you something to think about. That was all. Next slide. So this is going back to my conversation about muscle patterning, and then thinking about where physiotherapy can come in order to help with improving this muscle imbalance and making sure that we regain normal muscle pattern as much as possible. Next slide. So the thing I picked up from the last year's conference was really helping empower you to really think about maximising what you can do. Because I really appreciate that, for adults it's not the same as children. Children, they've got a massive capacity of regeneration and repair because they're children. And once you become an adult and your growth has stopped, then of course it's much harder. But it's not impossible. And so I guess my messages are going to be about maximising your strength and your stamina to the best level that you can do with what you've got. And thinking about your energy levels, but also thinking carefully about pacing your energy levels as well. And I see throughout the programme there's going to be a variety of different talks that will help with, planning, your days and planning your thought processes and planning where you fit in maybe exercise sessions versus work versus life versus your family, so that you actually can achieve the maximum you can for your disease. And I guess my other message is going to be about doing something is better than doing nothing. Because even if there's little control you have over your disease, over the deconditioning side of what's happening to your body, you can do a lot about. And we'll talk about a little bit more. Next slide. So what we do with the young people is that we split exercise into two things. I do this really because it helps me, it helps my team, and I think it helps the families understand that the physiotherapy exercises are treatment. They're not just sport and having a bit of fun. Because it sometimes gets a bit lost. People sort of think exercise is exercise and it's all the same. And if you go for a walk and that's the only exercise you do, then you've done lots of exercise. And I guess what I'm trying to challenge, certainly in the young people I treat, is that there are specific exercises you can do that actually make your walking more effective and easier. So I tend to think about the physiotherapy set exercises as a treatment, like a medicine, and that sport is more about having fun and being part of your life. So simple exercises are about correcting the biomechanics, about dealing with the muscles that really aren't working very well. And complex exercise is something where you use your whole body, and that can be around building up your stamina as well as using your whole body, and that can be much more fun things about walking and running and whatever sport it is that you fancy doing. And those two things are very different. But my physiotherapy advice is going to be much more about thinking about the very specific exercises versus using your whole body type of exercise, because we're looking at repatterning. Next slide. So how to train muscles. So fundamentally, the principles is you want to build up the amount of repetitions, so that's how many you do of each exercise. And what it's shown is that less than 15 repetitions is not really that effective. You really start becoming effective once you build up to sort of 20 and then 30 repetitions. So in my practice, the children all build up very quickly to 30 repetitions, even those with acute myositis. And then once they can do 30 repetitions well and effectively, then we start putting on resistance and we use weights because they're easy, they're cheap, and they can do them very easily at home. And the weights what I'm talking about are strap-on around the ankles or the wrists, because these are very specific exercises. Also, research shows that doing them once a week is okay, twice a week is a bit better, but the ideal amount of time of repetitions for exercising is about 4 times a week is ideal. I set the program for 5 times a week because that often works well with school and getting into a regular routine with school. I guess the same would be the same with work, because I could be routine, very led by routine Monday to Friday, but come Saturday and Sunday when I'm not going to work, my routine's completely gone to pot. So it's trying to be sensible and practical with that as well. But the other thing is about progressing, is starting where you can do, but then adding a little bit more, and adding a little bit more, and adding a little bit more. Next slide. The other thing, for us, we're talking about a home exercise program for the children, but I think it's the same for adults as well. I think, our motivation generally as a species to do exercise is not necessarily the greatest, but I think if the exercises are easy to do, and actually they don't take too long, and I would only set them to be done once a day at home, and they're very specific to the problem that young person has, then actually they're usually done much better. So if I'm only setting a 15-minute exercise program that's targeted to their specific problems, they are much more likely to do it than if I give too many or give choice. That's another thing that tends not to work, is children get given a sheet of exercise and say, do 1 or 2 of these every day. They don't end up doing any of them because they're not in a routine, it's not easy to follow. I tend to find that if I stick to give them 4 exercises to do, they do those 4 exercises and they come back and see me, then I change them and then they get into that routine. And that tends to work well with their motivation and their adherence to the exercise program. Next. So for the children, we tend to work on 4 particular exercises. So if you move on, I'll go through them. So one of them is about working on the knee in particular. So particularly vastus medialis, and I know myositis for adults as well. It's particularly affected in all areas of myositis. But the vastus medialis is the most important muscle, obviously, because that's the one that gets affected the first. Life's never easy, is it? But that muscle's the one that controls your kneecap, it controls your knee, gives you knee stability. And so an example of an exercise would be something like a straight leg raise, ensuring that muscle's firing, is against gravity, you're lying down, you're completely safe, so it's a really safe, easy exercise to do at home effectively, and you know when you've done it right or when you've done it wrong. So that's one exercise that we use a lot with the young people. Next one. Hip abductors, they're the muscle that takes your leg out to the side, but they're actually the most important muscle to hold your pelvis still so that you can then move your leg in walking. And one way of exercising that, again, lying down on your side, lifting your leg up and down. You need to be in the right position of that, so you might need someone to help you. And we are going to do an exercise session, I think Saturday afternoon, isn't it? So we could go through potentially some of these positionings for you in order to give you some ideas of things that you could do at home. Next one. Hip extension, that's your gluteus maximal muscle, that's your power muscle for propelling you forwards. There's 2 ways of exercising that muscle, either with your leg straight or with your leg bent. But again, the same thing. I don't want children to be put into any position at home that's unsafe, that's requiring balance and too much coordination. So these exercises are all done very easily. And in fact, the children who've been admitted to our program know these exercises inside out, back to front, and really don't need supervision. So even the very little ones. But they're also exercising the right muscles so they can put them into function. Next one. And these are building on strength around your ankles. Next one. And then there's some work around core central stability as well. But I think without these main muscle groups, core central stability is quite difficult to build on as well. Next one. So the messages are about exercising needs to be progressed. Don't stick to the same amount and stay on it forever. You need to keep changing it. Otherwise your muscles don't get stimulated to build and to grow stronger. Next one. The other aspect about things... Yes, I'm nearly finished, sorry. The other thing about is muscle memory, muscles, once you get them strong, you need to keep exercising to keep them strong, otherwise they forget to stay that strong and they go back to the weak level that you started with. So once you've built up your progression, then it's keeping with a program that helps keep you strong as well. Next one. And then, of course, it's thinking about how to build up your aerobic fitness as well. And there's a whole variety of different ways that you can do that, and we can talk about different options towards the end of that as well. Next. And then for the children particularly, I want them to enjoy sport. I don't want sport to be their exercise, because sport's what children should be doing. It should be how they're having fun and how they're joining in with life and their friends and their family. And so thinking about what sports they can join in is really important, but being also really careful that they're aware that it's not their exercise program, it's how their exercise program is how they're enabled to do these things. Next slide. So basically, it's thinking about how you progress your exercises, thinking about which muscle groups you're starting with, how you're working with those muscle groups, thinking about getting biomechanical control of your joints and your muscles, thinking about how you can put that into function as well, and also then thinking about increasing confidence within your own physical abilities as you increase your own physical strength as well. Next slide. Thank you very much. Yeah, so we're just going to swap the computers around and then, yes, certainly. Yes, do you want to? Do you have a question?
Yes. You mentioned 30 repetitions is ideal.
Yes.
But is it okay to do 15 and then rest a little bit and another 15, or do you have to do 30 continuous?
Okay, the question was about whether, because I talked about 30 repetitions, and whether you had to do all 30 in one go, or whether you could do 15 and have a rest and 15. The evidence shows that actually you could do 10, have a rest, 10, have a rest, 10, have a rest, and that's as effective as 2 lots of 15. The reason I stick to 30 with the children is it gets complicated otherwise. If I make it, with rest periods, then the children just get very lost with whatever it is they're doing. But effectively wise, yes, you're perfectly able to have some rest periods and it still be effective. Providing your rest periods, aren't 2 days, for example, but if it's a few minutes, it's entirely fine. But I think my caveat to that is I don't start them with 30. That's where we're building up to. I frequently start the exercises at only 5 repetitions and do that for a week, and then go to 10 and then 15. So it's gradually built up to 30, and 30 is the maintenance. But it would work very well with the rest period. Yep. Yes?
Is exercising the myositis affected muscles hurt their health? Say, you're quite
Yeah.
those that we,
Yes.
if you try to exercise with that function, or that help?
It would help. So the question was, if you have myositis in a muscle, is it safe to exercise the muscle that's got myositis in it? And the evidence is that it's safe to exercise the muscle that's got myositis in it, and in fact it's very helpful to exercise the muscle that's got myositis in it. But what you have to remember is that you can only exercise, you can start at the level you can do, but what you want to do is build a little bit more and build a little bit more. And I mean, with the young people that we have, I mean, they might only be able to do 2 contractions to begin with, but then the next day we make them do 3. And then it's 4, and it's 5, and you see then very quickly they get a very good recovery of those muscles, but also we're constantly training the patterning of when they're used. Does that answer your question? I can take one more question, then we need to move on, so yes.
My understanding, we've been led to believe that once the muscle is weakened, you can't rebuild it. And my understanding is that you said that to stimulate the muscle, to repair them is to repair the muscle fibers. So does that mean the complete opposite of what I've been led to believe?
Of course, you have to remember I specialise in children, so of course we have they're growing, regenerating, but satellite cells are present throughout your whole life. And so there is a ability to, because if you fight, myositis isn't like the whole muscle, it's patchy. And so there are healthy muscle fibres, and so you can build those healthy muscle fibres to compensate for the not so healthy muscle fibres, and you can still stimulate the satellite cells to come back as well. So it's not impossible. You will probably never gain the same that you had before the disease, but I guess the question is, in the part, I mean, I come from I've been doing this for 25 years, and we were also in the children told don't touch them when they had active disease, you'll make them worse, and I didn't believe it. So my research, first of all, was about proving that that was wrong, which I proved, and it was wrong. And so actually you get a much better outcome and you rebuild muscles to a much, much higher level than if you just let them do whatever they want to do. You know, if I put you into bed for 2 weeks, you would have you'd be really weak, and if you just didn't do anything, you'd stay in that weakness. But if you did something about it and retrained your muscles, you'd get back. So I think the answer is you can repair, but maybe not completely, but you can still do better than doing nothing at all. Nothing at all is more harmful than doing something.
So thank you for the question. If we could exercise muscles that are affected by myositis. I come from the Karolinska Institute in Stockholm, and on the picture there is our research group led by Professor Ingrid Lundberg, she's in the middle. In the beginning of the 90s, she also said to patients that don't exercise when you have myositis. And then there was a couple of patients who were naughty, they did not follow her recommendations. And one man in his 30s, he came with dermatomyositis, he came in and did lots of push-ups on her office floor. So that led her to believe, well, maybe this is not true. Maybe you can exercise when you have myositis. So me and Ingrid got together in the middle of the 90s, and she asked me, well, can you develop an exercise program that we can test in a research study? Next, please. So I think we will skip a couple of slides here to save time. Next. Next. So what we want to measure, have you all met a physical therapist? So you go to your rheumatologist or neurologist and they maybe measure your muscle strength. What's been proven in, especially inclusion body myositis, is that this handheld myometer is a reliable measure to follow muscle weakness. We can also assess it in a Biodex system where you connect your movement to a computer. We have developed a functional index too. It's a measure where you assess muscle endurance. So I think you can say something if you don't agree. That maybe in inclusion body myositis is mostly the muscle strength that is affected. You have difficulties raising up from a chair or reach something even for a very short period. But maybe what I've been understanding from our patients with adult polydermatomyositis is that it's also, or mainly, the muscle endurance that is affected. And we'll come to that when we talk about how many repetitions you need to do. It depends on, do you want to improve your muscle strength? Just the capacity to raise up from a chair once, then you need to do fewer repetitions, but maybe with a higher resistance. But if you want to be able to walk 10 flights of stairs, then you need more muscle endurance. And then you need to do many repetitions with a lower weight. But I'll come back to that. We also do different walking tests, 30-meter walking test, 6-minute walking test. Next. We use a test called timed up and go. So you sit on a chair and you walk 3 meters, you went on a coin, and then you go back and sit down. So this is a test that's been done in inclusion body myositis in the study that I will talk a little bit about later. We also measure the ability to stand up from a chair, and we can assess maximal oxygen uptake. Has anybody done that kind of a test? Yes. Did you fall off the bike? No. But the idea is that you keep on working and they increase the loads, and you're wearing a mask to control how much oxygen you breathe in and carbon monoxide. Is that right? What you breathe out? Okay, thanks. But you can also do, so there you get your actual maximal oxygen uptake for you individually. You can also do submaximal oxygen tests that is more based on where you estimate your aerobic capacity. Next. We also assess activities of daily living and quality of life with different questionnaires. And next. And maybe you recognize this. You're supposed to fill out your pain or your fatigue or your disease activity on this line. Are you familiar with this? Yes. So this is what I believe that the rheumatologists are. This is kind of a global assessment of disease activity, for example. So next. So, like 20 years ago, it said in a textbook that you should not exercise if you have myositis. And that notion was based on studies done in marathon runners, healthy people doing marathon runs. So they had skyrocket CK levels, and they had inflammation in muscle. So from that they said, well, if you already have increased CK levels and muscle inflammation, then you shouldn't exercise. So there are actually no studies stating that exercise could be harmful in myositis. Just depends, you should not go out and do a marathon maybe. So you can always do something and adapt what you're doing to how you're feeling. So the first studies in exercise were a few case studies published in 1993 that got me and Ingrid Lundberg thinking, and some other people too. Next. So today we have 17 published studies looking at different kind of exercise programs in myositis. A few years ago, in 2011, a systemized review came out stating that the methodology of these studies are high, they're high compliance, the participants really did what they were supposed to do in these studies, but there is a bias in terms of selection. So this is a rare disease with difficulties to get participants in exercise studies. It's mainly people who used to exercise before they got myositis, for example. And we include people in all ages and both men and women. But all of these studies, although some are small and uncontrolled, uncontrolled, were all supporting safety of exercise. Thank you. Next. So I'm just going to add something about why the muscles get weak. We've been looking at lactate levels. So lactate is produced by the muscle whenever you do muscle contractions, and the levels in the muscle or in the blood doesn't increase until the production exceeds the rate of removal from lactate in your muscle. And this removal process is governed by many factors, but one is the muscle's aerobic capacity. And that could be, for example, the numbers of capillaries that you have in the muscle. There are studies showing that patients with polydermatomyositis have a lower number of capillaries in the muscle. So there are two studies looking at lactate levels after an incremental exercise bout. They came to different conclusions. The first said, well, patients with myositis have higher levels than healthy controls. The study that we did came to the conclusion that there was no difference in lactate levels. And I think this is due to there are still small number of patients included, and maybe different kind of exercise bouts on different intensity levels. What we could see was the patients who went into an exercise study could reduce their lactate levels and improve their whole body aerobic capacity. There is also a study showing that patients with dermatomyositis have reduced level of phosphocreatine in rest and during exercise. And that's creatine is used, you have it in the muscle, and it's used during, it's an important factor to have a muscle keep on working. Next. So this is a program that you can do that we have evaluated in research studies. If you're recently diagnosed with polydermatomyositis, or if you're into a flare that you need to adapt what you're doing, or if you have not been exercised at all for a very long time. Next. So it's a warm-up, stepping up exercise. If you're very weak in the shoulders, then you're having trouble to lift your arms above your head, and to make sure that you don't get contractures in your shoulder joints. This is an important exercise. You can exercise your grip strength, and this program targets really the affected muscle groups like the knee extensors, shoulder muscles, and also hip flexors. And what we could see that this program could improve muscle function, both in patients with an established disease and patients who had a recently diagnosed disease with high CPK levels and high corticosteroid doses. It improved quality of life in domains of physical function, pain, and fatigue. And what we could see here, there were no signs of increased muscle inflammation, either if you're an established disease or if you have active. So the patients with active disease, they had high CK levels from the beginning, but after 12 weeks, they were much lower. Thank you. Next. So in this study, we got started about 4 weeks after your diagnosis. So we started up with about 10 repetitions for each exercise. And if you just show the next slide once. I usually, in this study and in my clinical practice, I use this Borg scale. Have anybody seen it? You can rate your perceived exertion here. So if you say, so if I ask you to lift your arm 20 times, and then okay, you say 0, then it was no exertion at all. I could have done this, could have kept on doing this all day. And if you say 10, then it was extremely strong exertion. So starting up an exercise program, and this means like any exercise program, I think a level of 3, a moderate exertion would be good place to start. Can you go back? There were one more, thanks. And this exercise program was also advised to do 5 days a week. So shorter, if your muscles are weak, shorter exercise sessions, and be sure to vary what muscles you're working with. So you don't do all the arm exercises at the same time, and then you do the leg exercises. So you don't want to overexert any muscle group. Thank you. Next. Yeah. Did we skip a slide? Yeah, thanks. This program was also evaluated together with frequent walks. So patients were walking, or if they were unable to walk, they were able to climb up on a stationary bike. And they should do this at least 20 minutes, 2 to 3 days a week. And here you can, to exercise your aerobic capacity, you should be on about 50 to 70% of your maximal heart rate. And you can calculate your maximal heart rate. So if you take 220 minus your age, then you have your estimated maximal heart rate. That can vary. Maybe I have a lower maximal heart rate than you do. But if this maximal heart rate decreases by age. And then you calculate 50 and 70% of, so I did the calculation, so my estimated heart rate is 175. So I calculated 50 and 70% of this and ended up with a range of 87.5 through 122. So you can monitor your heart rate by hand. Here is a good place to feel your heart rate, or on your wrist, or you can use any kind of heart rate monitor. Thank you. So the following program can be applied if you have low disease activity and lower corticosteroids. You should not do the following program if you have severe osteoporosis and you have experienced fractures. If you have corticosteroid doses exceeding about 20 milligrams. And that's because corticosteroids are a catabolic treatment, so it will make your muscles a little bit fragile. And we also had one patient who had severe arthritis of her hands, and she experienced some increased pain with this program. Next. So here we did also targeted muscle groups where we wanted them to find an intensity of 10 voluntary repetition maximum. And that is the weight that you can lift 10 times, but not 11. So that makes it about 70% of your maximal strength. So they exercised 3 days a week for 7 weeks, and this program could improve muscle strength very much. We had some muscle groups improved between 20 and 900% during these 7 weeks. We didn't see so much improvement in muscle endurance, however some. And we could also see that this program could reduce disease activity, assessed clinically by a rheumatologist. We could also see the genes regulating inflammation. We did muscle biopsies before and after. And we can see the genes regulating inflammation were downregulated after this exercise program compared to before. Thank you. Next. So it's good to get started under supervision of a physical therapist, although I know that we are working under different circumstances. In Sweden, we work in teams, so we have a special myositis team where I am a PT. But if it's possible to get started with someone who can guide you. Start with lower loads, so I would say introduce with a 20 voluntary repetition maximum, so allowing 20 repetitions. And always warm up before, and don't forget to stretch. And to achieve this effect, you should exercise at least 2 to 3 days a week. And progress the exercise to eventually reach this 70% of your maximal strength. It's normal to experience muscle soreness a couple of days after exercise, especially in the beginning and after just after you have progressed. Okay, next. Okay, next. So if you want to improve your aerobic capacity, and this goes for both PMDM and the inclusion body myositis, you can do this program next. So we've been looking at exercising 3 times a week. We've been doing biking, but you can do like arm cycling, or you can do Nordic walking, or whatever kind of exercise, but you have to increase your heart rate, so you reach about 70% of your maximal. So we did 30 minutes, 3 days a week, together with some quadriceps training as well. And this was endurance, so allowing 30 to 40 repetitions. Next. So in this program, we improved the aerobic capacity, and also the ability to bike for a long time. It improved strength and endurance. It improved the the participants' ability to do daily activities and improve quality of life, reduced fatigue, and we could also here see reduced disease activity and inflammation. Thanks. So remember I said something about patients having too little creatine in their muscle. So we did a study. As you can see here, the creatine is used So the red one is creatine. So it's used mainly the first 10 seconds or 20 seconds of your work. And it's important in the muscle energy up to 2 minutes of exercise. So we participated in a study together with King's College where patients with polydermatomyositis took creatine supplements together with the home exercise program that I showed you before. And for the first days they took I think it's next slide. Yeah, they took a loading dose of 8 grams per day, which means 5 kilo of meat. You can convert it to get the same amount of creatine. And then they continued with a maintenance dose of 3 grams per day for 3 months. Then they took a break for a month and then they were continuing again on the maintenance load. And what we could see that those people who exercised and took creatine supplements improved their muscle strength more than those who only exercised. Creatine supplements can only have a positive effect on your outcome if you exercise regularly. It doesn't have to be strenuous exercise, although you have to do the program regularly. So if you don't exercise, don't take creatine supplements. Next. So this is a home exercise program for IBM. This was evaluated in a small study with only 7 patients. Some of them were walking with a stick. One patient was in a wheelchair. Next. And what he did was this home exercise program that the participants performed twice a day for 16 weeks. It included whole body sit to stand exercise. They were doing biceps curls, shoulder press, seated rowing, and also working with the muscles in the lower limbs, like the calf muscles and the vastus medialis of the thighs. Next. And this program improved muscle strength in all the muscle groups that they were assessing. Also in grip strength and in the quadriceps, which was new. It had never been shown before. Other kind of exercise programs with regular strength training 3 days a week was shown to improve your strength in less affected muscle groups, like maybe the back of your thigh, or which is also good. I mean, they can compensate if you increase your strength in less affected muscle group, that can increase your function anyway to compensate. It improved the ability to stand up from sitting, and also the ability to walk. And this was only, this needs to be shown in a more controlled setting, but I give the IBM patients that I meet in my clinic, I give them this program. And those who can sustain the 16-week, twice a day, they have improved. Some of them who has done this once a day has also improved. And so I think to continue, it's impossible to do twice a day exercise every day, all year round. So my theory is that you can start off with 16 weeks and you see improvement, and then you can go off to other kind of activities, aquatic or gym training, and then when you feel it's time, you can go into a new intensive home exercise period. The programs that I've been showing now, we have Sue and I have sessions on Saturday, 2 p.m. and 4 p.m., where we will show you how you can adapt these programs to the way that you're feeling. See if I have any slides. I want to wrap this up. I talked about this. Next. Next. So, what we can conclude right now is that for healthy, they say that the recommendations are to improve your strength. You should exercise 2 to 3 times a week on 60 to 80% of your maximal strength. And to increase your muscle endurance, you should exercise 2 to 3 days a week on 30 to 40% of your maximum strength. And to increase your aerobic capacity, you should exercise 3 times a week on 60 to 85% of your maximum heart rate. And we think that this goes for people with myositis too. And then we also should think about the health-promoting physical activity. But you should be physically active, doing something most days of the week. Thank you. I think we'll wrap this up. Okay? So now we have time for questions. Yes?
My question is specific to IBM. Several of the slides you talked about, especially Sue, about muscle repair or rebuilding muscles. When I went to Johns Hopkins, the way they explained it to me with IBM, you've got the capacity to rebuild that muscle, with the capacity to exercise, to maintain it, or to lengthen out the amount of time that your muscles are there for you. So exercise in an IBM patient does not rebuild anything. They use the analogy of a box coming of a weightlifter. When they lift weights, they actually destroy their muscles and rebuild it back, which gives them more mass. And he was saying, in my case, if I over-exercise, he wants to exercise, over-exercising has a deleterious effect on the muscles because there's nothing to rebuild back. You're using muscle that cannot come back if you over-exercise. I wonder what your thoughts
are. So the question was, is there a danger of over-exercising your muscles if you have IBM, as the muscles are not regenerating? And I would say the answer is that we don't know. From the short-term studies that have been done, it doesn't seem to have a negative effect. But there are no studies looking at the long-term effects on muscle fiber size, or.
When the muscles being rebuilt in IBM, can you actually rebuild muscle versus lengthening and other times you use?
I think what you have to realise is that muscles are not one thing. If you take one muscle, it's made up of many fibres, and not every fibre is affected. And so what you can do is that the fibres that aren't affected, you can actually maximise their effect by exercising, and you can make them bigger than they were in the first place. And you still do have satellite cells that still can come back and be put into place into those muscles. Now, again, there is no research to show that how much you can improve, but actually there's a lot of work that you can do improvement. The research that we've just been presented will show that as well. So the analogy, I think the thing that people get very confused with is that it's about the intensity of exercise. If you choose people like boxers and bodybuilders and marathon runners, they're all extreme sports. They all do extreme things to their muscles. And you probably can't do that to your muscle.